At Star City Hospice, our mission is to bring specialized care to patients and families facing a life-limiting illness, and to meet, listen, and assess where each patient and family are in their journey and support them with individualized care, kindness, and compassion. Our vision is to provide the very best care to our patients and families through increased presence, being there for the patient and family when they need us, and anticipating changes in care and education along the way. We serve Dallas-Fort Worth and the surrounding area. Star City Hospice provides care wherever the patient calls home. Our compassionate team comes directly to you. Once admitted, Star City Hospice manages medications, medical equipment, supplies, and more, ensuring a seamless and supportive experience. Our core values are passion, communication, empathy, integrity, and unity. At Star City Hospice, our model starts with our care and commitment. We ask ourselves, if this were our mother or father, what would we expect from a hospice provider? We then commit to delivering that same exceptional level of care and compassion every single day. Through dedicated staffing, we prioritize patient care. While each patient's care plan is unique, we emphasize increased weekly visit frequencies by both nurses and nurse aides, along with maintaining low total patient caseloads. By reducing the total number of patients our team manages, we enable them to spend more time with each patient and their family. Star City Hospice responds promptly to all patient and family requests and needs, then follows up to ensure resolution. We approach every patient referral with a sense of urgency, striving to complete admissions for eligible patients on the same day or at the very latest by the following day. We understand that medical equipment and supply needs can be a significant source of stress for patients and families. That's why we work diligently to ensure these needs are consistently met. Our services include providing ample supplies, such as incontinence products, as well as delivering essential equipment like hospital beds, wheelchairs, oxygen concentrators, and more to support the patient's care and comfort. In the final moments of life, presence matters. At Star City Hospice, we recognize this and are dedicated to being there for patients and families during this profoundly difficult time. Our bedside presence program, along with our commitment to initiating continuous care promptly when clinically appropriate, are two ways we honor that commitment. Star City Hospice is committed to honoring the service and sacrifice of military veterans. As a proud partner in the National Hospice and Palliative Care Organization's We Honor Veterans program, we uphold this commitment through veteran recognition ceremonies and specialized staff education focused on veteran-centric care. Exceptional communication is essential in healthcare, especially in hospice care. Star City Hospice is dedicated to maintaining superior communication with our patients, their families, and our facility partners. After each visit, we provide updates to families to ensure they are informed of any changes regarding the patient's condition. For patients residing in a facility, our staff ensures that our presence is known by checking in with the facility team upon arrival and before departure. This ensures we remain aligned on the patient's needs and any observed changes. Additionally, we prioritize notifying both families and facilities of any schedule adjustments to maintain transparency and coordination. The Hospice Interdisciplinary Team. The Hospice Medical Director plays a vital role in overseeing the care and treatment plans for each hospice patient. This includes certifying that each patient meets the criteria for hospice care. Additionally, the Medical Director collaborates closely with the entire clinical team to ensure comprehensive and compassionate care. The RN Case Manager is the leader of each patient's care team. They manage the care plan for each patient in collaboration with the medical director and clinical leadership. The RN case manager is involved closely with the patient and family. They order medications, equipment, and supplies as needed, as well as coordinates with the other members of the interdisciplinary team. The nurse aide is a key member of the hospice team, often visiting the patient more frequently than any other staff member. As such, they serve as the eyes and ears of the team, helping to identify and anticipate the needs of both the patient and their family. The nurse aide assists with activities of daily living, such as bathing, feeding, dressing, and mobility support. The hospice social worker will assess each patient after admission. During the assessment process, they will help to identify needs of the family, such as assisting with document preparation and planning. Hospice social workers are skilled at being solution-oriented and meeting the needs of the patient and family. The hospice chaplain meets patients and families where they are currently on their spiritual journey. This approach fosters open dialogue, helping to navigate the many emotions that arise as health declines. Our chaplains serve as counselors, providing an additional layer of support and comfort, while also collaborating closely with the hospice care team. They offer spiritual support and guidance tailored to the unique beliefs of each patient and family. Chaplains can also collaborate with local faith leaders to arrange for faith-specific support as requested. Star City Hospice's bereavement coordinator supports each family for 13 months after the passing of a loved one. With care tailored to the family's unique needs, this support may include cards, phone calls, or visits. Additionally, we offer multiple caregiver and bereavement support groups to provide ongoing comfort and guidance. Volunteers play a crucial role in hospice care by providing emotional support, companionship, and practical assistance to patients and their families. Volunteers can also support patients with daily activities or light housekeeping. Through their compassionate presence and dedication, hospice volunteers enhance the overall care experience, ensuring patients and families feel valued, supported, and understood during a difficult time. Star City Hospice may collaborate with healthcare specialists, such as physical therapy, occupational therapy, speech therapy, and dietitians on a case-by-case basis to provide palliative comfort measures. This collaboration is focused on enhancing comfort and is typically provided for a shorter duration than in home health care. At Star City Hospice, all after-hours and weekend calls are answered by a live nurse, available 7 days a week, 365 days a year. Whether a need arises at 7 p.m. or 3 a.m., we respond with a sense of urgency to support patients, families, and facility partners. These skilled nurses can assist with resolving issues over the phone, such as medication needs. However, when an in-person visit is required, they contact our on-call staff to ensure expedited service. Star City Hospice has a dedicated team of skilled nurses available after hours and on weekends. These nurses are dispatched by our triage team to assist with any patient or family needs that may arise. The triage and on-call teams can be reached by dialing our office number at 469-529-2954. Contact us today to learn more.